What's your sense of the pace of change over the next 5 years?
I think the pace of change is going to be remarkably quicker than the analogy that I'll use to describe the model. I had mentioned the business plan formative stages, and the analogy was that if surgery centers can partner with health systems to move low acuity surgical procedures, then we should be able to do the same for medical. And so I'll use another surgery center analogy. If you go back to the early 80s, when CMS first began reimbursing for surgical procedures in an outpatient setting, about 6 or 7% of all surgical volume was done on an outpatient basis. And so that was either in an HOPD setting or in a true ambulatory surgical center. As CMS began reimbursing for more services, as providers began performing procedures in that setting, they became more comfortable with the model. And then ultimately, consumers realized that this was a safe and effective way to receive care. You had surgical volume in the United States move to 2/3 on an outpatient basis. And so I think you can see that same trend in hospital care at home. And I wouldn't confine it just to hospital care at home, SNF care in the home, palliative care in the home. I think you'll see a tremendous uptick. I do think that the adoption curve will be much steeper because, an unintended byproduct of COVID is that it showed those providers that this can be done in a safe and effective manner. And so it won't take them quite as long. And so I think you'll see the same thing play out with medical conditions.